Hey everyone, so today we're going to continue on with learning about first aid. We're just going to go over the bone, joint, and muscles acronym RICE again, just because this is such a common injury, you should really know what to do in this situation. So anytime someone injures a bone, they injure a joint, or they hurt a muscle, you think of RICE. So the R stands for rest, do not move or use the body part. I stands for ice, apply cold for 20 minutes every 2 to 3 hours. Wrap the ice in a cloth so it is not in direct contact with the skin. Again, we talked about that last time, that after an injury, it won't help to freeze that part of the skin either, so make sure you're just applying cold, you're not trying to freeze the skin. C stands for compression, so apply an elastic or a tensor bandage when not icing. And then E is elevate, so keep the injured part raised higher than the heart. So our diagram here doesn't do a great job of showing elevation. They have it somewhat elevated, but you want to try and get it so that the injured area is higher than the heart. So today, you're probably wondering why I'm here at the bottom of your screen. We're going to be talking about CPR, and it's a lot easier to understand CPR if you can somewhat see what's going on. So, CPR stands for cardiopulmonary resuscitation. So the first thing that you need to think of when you're doing CPR, and just a disclaimer, again, you are not going to be trained to perform CPR after this crash course in what CPR is. You are not certified, this is just for your own understanding. So anyways, we think of RAB, which is responsiveness, activate, and breathing. So the first thing that you're going to do is check the responsiveness of the person. So you just tap them on the shoulders just like this, talk into their ears, ask them if they're okay. If they're responsive, they don't need CPR, but they might have some other injury. So you can ask them what they need help with or if they're injured. 2 is to activate EMS. You call a bystander over and get them to call 911. We talked about that last time, that you don't want to call 911 yourself if you're helping, you want someone else to do it. If there's nobody in the immediate area, shout for help, try and get somebody else to come and help you, and then worst case scenario, you call 911 and do both CPR and 911 emergency response. So then third, you're going to check for breathing. So you're looking for breathing movement, you listen for breathing sounds, you feel for air coming out of the mouth, and if the person is not breathing, CPR is needed. Okay, so again, you're just thinking of that acronym RAB before administering CPR. So after RAB, we have CAB, great little rhyming acronym, RAB, CAB for CPR. So CAB stands for compressions, airways, and breaths. So for compressions, I'm going to use this lovely model. This is absolutely not accurate, but will help me to kind of demonstrate the motions of compressions, how to open the airway, okay? So for compressions, you are going to place the heel of one hand, so this is the heel of your hand, in the center of the chest. So this, we're going to say, is the center of the chest here. So you put the heel of one hand in the center of the chest, which is just below the breastbone, and then you put your second hand on top and interlace your fingers. So you're creating this sort of shape. Okay, so you're going to interlace your fingers, one hand on the bottom, one hand over top. What you do is then keep your arms straight. So we're not bending our arms when we're doing CPR. You keep your arms as straight as possible and push down with your whole body. Okay? So you want to make sure that you're compressing the chest by 5 to 6 centimeters. So arms straight, right on top of the body, pushing down 5 to 6 centimeters. Again, you want to make sure that you're pushing down actually quite far, because the idea is that you are causing the chest cavity to breathe. So you're compressing and then allowing the chest cavity to fill back up with air. So you have to be pushing quite hard to cause that chest to compress and then open up again. So you're pushing at a rate of 120 beats per minute, which is to the tune of Staying Alive by the Bee Gees. So it's about like this. Okay, so that was my wonderful demonstration of compressions with this volleyball. Next, we're going to talk about checking the airways. So you want to make sure that the person's airway is open and they can breathe. So we're going to pretend that this is the person's head this time. It was just the person's chest, so now this is their head. You're going to push, you're going to put their head, we're going to pretend this is the forehead here. You want to place one hand on the forehead and apply pressure to tilt their head back. You can also put 2 fingers kind of underneath where the chin would be and use that to tilt. So you're opening the head backwards, opening it up so that their airway opens more fully. And then for breaths, I don't have any way to demonstrate that, but the idea is that you pinch the nose and give 2 breaths, each lasting for 1 second, and you allow the chest to decompress after each breath. So you breathe in and then let the chest decompress. Give 2 breaths for every 30 compressions. So again, if I set up in my compressions, I would push 30 times and then tilt the head back, lift with the chin, and give 2 breaths for every 30 compressions. So you actually don't need to perform breaths if you're not comfortable and don't have the right safety equipment. So when you're typically performing breaths in CPR, you have a little block that goes between your mouth and their mouth so that you are not exchanging bodily fluids. So if you don't have that, you are under no obligation to perform breaths. You can just perform chest compressions. And one thing to note, once you begin CPR, you cannot stop until someone who's qualified takes over. So once you start CPR, you are obligated to continue on until either EMS arrives and takes over, or another person that's a bystander who is also qualified in CPR takes over for you. So moving on from CPR, we're just going to talk about an AED right now. So an AED is an automated external defibrillator, and it's a device that analyzes heart rhythms and can shock the heart back into a regular rhythm or reestablish heart rhythm if the heart has stopped beating. So your heart actually beats due to electrical impulses throughout the heart and then in your body. So what the AED automated external defibrillator will actually send electrical impulses to either restart or kind of shock the heart back into its regular rhythm. So AEDs come with very, very clear instructions on them, and they actually speak to you when you're using them. So they're very user-friendly. So first step is to turn on the AED. There's a big power button on the AED. You then attach the pads to the bare chest. So you're making sure that the person is not wearing a shirt, and you're attaching the pads to the bare chest in the correct places. It tells you on the AED where to put them, but these pads need to be on the skin so that the AED can sense whether it needs to shock or not. After you place the pads on the person, you stay clear of that person and make sure no one else is touching them, because like I said, so the heart creates its own electrical impulses, so you have electrical impulses going through your body. If you were to be touching someone that had an AED on them, the AED could potentially sense the electrical impulses from your body and give you a false reading for what you need to do. So make sure no one is touching them. After that, the AED will speak to you and tell you what to do, including whether to shock the person or to start CPR. So sometimes it says to start CPR, and sometimes it tells you that it will shock the person. If it tells you that it's going to shock, you make sure everyone is still standing clear, and then you press the button to shock. There's a really large button on an AED. So after it's shocked, give 5 sets of compressions and breaths. Again, if you don't want to do breaths, just estimate about 5 times 30, obviously, because that's our ratio of breaths to compressions. So 5 times 30 compressions, and then you can potentially place the AED back on and see if it needs to shock again. If at any time the person starts breathing on their own, you do not keep performing CPR. You don't place the AED on them. If they perk back up, obviously they still need to go see EMS, but you don't have to keep continuing with CPR and an AED. So just 3 things I want you to take away from this and remember. 1, you're not certified to perform CPR. So if you see someone that needs CPR, you are not certified to do so. You can obviously do things like putting pressure on a wound. You can help use the Rice principle if someone has injured their ankle or sprained their wrist, something like that, but you are not certified to perform CPR. Make sure that you stay safe. Always make sure that an area is safe before you try and help someone with an injury. You will be no help if you yourself are injured. So if you're going to a situation and you notice that something is potentially putting your life at risk, do not go and try and help them. Wait for EMS to arrive. That's the best thing you can do. and call 911. Stay calm and call 911 if there is ever any emergency situation. So if you're in an emergency situation, even if you're trained in CPR, there's only so much you can do. You need someone who's perfectly qualified and well trained in each of these situations. So that would be someone like a paramedic or firefighter. Call 911 and they will come and help out.